My name is Samantha Myers.
Mine is Micah Brenner.
My name is Simmy.
I am 13 years old.
I'm 11 years old.
I'm 20 years old.
And I have familial dysautonomia.
It's the orphan of orphan diseases.
We are their lifeline.
They are tireless saints.
We are always there for the families.
The purpose of the Dysautonomia Foundation is to pursue medical treatment, research, public awareness, and social services for the benefit of people with FD.
We saw some of the biggest and brightest doctors around New York at Columbia and other places to try to understand why he seemed to be falling a lot and why he didn't feel pain and what was going on.
Having spent 6 months going to every specialist in the New York City area, etc., to try and figure out what was wrong with my child, walking into the Dysautonomia Treatment Center was like, crossing the River Jordan into the Holy Land.
Without Dr. Axelrod, we would not be here at all. Jack would not be here.
A child who was born in 1970 only had a 50% chance of surviving past their 5th birthday. Today, an individual born with this disorder has a 50% chance of reaching the age of 40.
But it's not only that. It's that the quality of life has changed. What used to be a life of really complete suffering is now a life where people have some really good days, really good months, and really good years, and live productive, happy lives.
Familial dysautonomia affects the autonomic nervous system. This is a part of the nervous system that affects every other part of the nervous system.
The brain of people with FD lacks that information that you and I have about what's happening in our body.
It affects the eyes, it affects nutrition, eating, breathing, the spine, so that you have to really look at the total child and understand every aspect of their well-being.
So this lack of information, the fact that the cables do not take the information from their body, makes their physiology very, very special.
To understand dysautonomia, you have to understand the spectrum of a disease.
I would call it personalized medicine. And why do I call it personalized medicine? You see, people with FD have a set of very peculiar problems. They have problems with their blood pressure, they have problems with their kidneys, problems with their breathing, problems with their bones. And although there are similarities between patients, there are also differences, and each of them is his or her own individual and has a very specific pattern of abnormalities.
Some kids don't eat at all, some kids eat everything, some kids drink, some kids don't drink.
There are certain things that I can't, that are hard for me to do, like run and walk.
I have to eat my tube. I always spit drops in my eyes. I have to get very close to things so I cannot see everything. I get tired very quickly and do not want for. Sometimes I feel so sick that I'm gonna pass out.
I could go blind if I don't do eye drops. I could faint if I don't drink a lot.
There are also certain foods and drinks that I can't have because they could turn into liquid and get into my lungs.
There is strength in numbers, and there is absolutely no way to treat a relatively rare disease or rare disease like FD if you do not have a center in where all the patients come and that you can really understand what their problems are by realizing that you need a critical mass so that the treatments that you do, you can really evaluate them in a controlled and proper way.
And once you have established a center of excellence where people can come and share the information and create a database and analyze what you do in a very scientific way, then you can apply that information to the patient and they will benefit.
We're in a unique position where we have a large population of FD patients, and we're the only facility in the world that can look in such detail at these reflexes, and we're poised, if we can, to understand the problems.
You can see the change you can make in other people's life, and we already noticed that in some part with our effort, lives of several patients have been substantially improved, and that is extremely rewarding feeling.
From the personal point of view, it's also very interesting because these patients are very warm and they are absolutely counting on us to be there.
The Dysautonomia Center has had a significant impact on the health and welfare of these children. We have been able to continue to offer comprehensive care to these families. We are a resource for them. They are able to refer their own physicians to us. They're able to refer their teachers to us, their therapists to us, and we are always there for the families.
In the middle of the night, once Perry needed to go to the emergency room, and Dr. Axelrod was standing there waiting for us at NYU's emergency room, holding the door open because she wanted to make sure that my daughter got the proper care, even in the emergency room.
Sometimes those 3 a.m. phone calls, my husband and I toss the phone back and forth. It's like, okay, who's going to wake her up? But she's always available.
Just like 7-Eleven. They never close, right, Phil?
The level of commitment as a doctor, she's not just there to clock in, and she's not in there for her own merits. She's there for each and every patient.
The doctors at the Familial Dysautonomia Foundation are hardworking, caring, and they do what they need to do to get the job done.
When I go to the center and see the doctors, I feel like they're going to take care of me.
They try and encourage me every day to do what I can do to function well.
You knew them for so long, they feel like part of the family.
We give 100% of ourselves to these patients and these families so that they can enjoy a better quality of life.
They are, tireless saints in terms of making the kids' lives easier.
We get calls from all over the world on a daily basis, asking for advice, asking for recommendations. Our parents feel, and the patients feel, that we are their lifeline, and they have grown and developed to young adults and adults.
It's not like people with FD have other places to go. Other doctors don't know about this. It's not part of normal medical school training. It's the orphan of orphan diseases. Orphan diseases start at 20,000. This population alive now is 300.
It's very lonely being a young person and being different and having medical problems. There's only 600 or so kids that have ever had this disease, and so she walks alone a lot.
And since there are so few of us, and since so many of the experiences that we share are so similar, we'd like to reach out to one another and find out, how did you deal with this, or what would you suggest?
In 2001, something very exciting happened. We found the gene for familial dysautonomia. The immediate effect of that information was that we were able to launch population screening.
There's a test, but people need to know there's a test. Doctors need to know there's a test. Rabbis need to know there's a test. Before the people get married, we're going to put them together. You make sure that they get tested.
We've been really good at preventing new cases of FD through public education and screening. And we've been able to let people with FD live longer lives. That's given us a new adult population. And quite frankly, we don't have a lot of experience with people who are adults with FD.
We're starting to see new problems, which we did not see before. So we've conquered the issues of the child, and now we have to meet the challenges of the adult.
Michael is 27 years old, and one thing about Dr. Axelrod is that she always kind of thought outside the box before it was fashionable. And if we had just followed traditional medicine, we never would have gotten as far, and Michael never would have gotten as far as he has. Dr. Axelrod would say, you know, why don't you try this? Let's see what happens. And if it worked for us, then she would know to try it on another patient. And it just kept on spreading that way.
This is a degenerative disease, and they don't have the time for us to proceed slowly, and we must increase our research and apply those findings as quickly as possible.
We are now ready to roll out several studies, prospective studies, using new drugs and new treatments to try to approach or to treat effectively the problems that people with FD have.
With 350 alive in the world today, and with no real doctors other than the Dysautonomia Foundation and a few handful of doctors working on finding a cure, we're not on TV. You know, we're not in every household name. So no one is going to give unless it's the friends and the families of those affected spread the word and each try to do their own part and get the donations and the support.
My family would not have survived the last 18 years without the FD Center and the people that are there.
It tells us how to live with FD.
If there would be no center, then there will be no one to help us.
Physicians and therapists and school personnel don't really understand the disease. Some may know a little bit about it, but without the guidance of the center, it would be a real struggle to get through each challenge.
There really have been some incredibly powerful, wonderful moments that we could never have if we didn't have the pretty stinky ones too.
When you live with a child who might have anything different, red hair, short, tall, big, you don't comment, you don't focus, you don't think about it. Every day is a true blessing.
I think every minute of their life is important, and that you should celebrate it as much as you can. I would never back down for me to Dysautonomia, because I am a tough fighter, and I never give up.
My parents would always say, I know it stinks, but you live and you learn.
Because you'll never know what tomorrow will bring you. It may be a test, or it may be a fun day. You may never know what it will bring you.